Are you struggling to keep up with the ever-changing regulations surrounding patient confidentiality, specifically related to substance use disorder? Well, you're not alone. The Department of Health and Human Services recently finalized new rules aligning the confidentiality of substance use disorder patient records, also known as Part 2, with HIPAA and HITECH Act requirements. So are you feeling overwhelmed? Well, don't worry, I've got you covered. Hey everyone, and welcome back to the channel. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies regarding health information, healthcare compliance, the revenue cycle, and how to become a certified marketable medical coder. Today we're diving into a topic crucial for all healthcare professionals working in the behavioral health space: confidentiality of patient information, again specifically related to SUD, or substance use disorder. Over the past year, the Department of Health and Human Services, or HHS, has finalized some important changes to the regulations governing this area known as Part 2. These changes aim to align Part 2 with HIPAA and the HITECH Act requirements, impacting how you handle crucial aspects like patient consent, disclosures, breach notifications, and more. So are you feeling a bit lost in all this legal lingo? Well, again, don't worry, because I'll break it down into simple, actionable steps you can take to stay compliant. So grab a pen and paper, hit that subscribe button, and let's get started. Traditionally, obtaining patient consent for using and disclosing SUD information has been a bit of a paperwork maze, but the good news is the new regulations introduce a streamlined approach. Instead of needing separate forms for different purposes, you can now utilize a single consent form for treatment, payment, and healthcare operations, or TPO. This means one form can cover a wider scope, reducing administrative burden for both you and your patients. However, it's crucial to ensure this single consent form clearly explains the potential for records to be redisclosed beyond your control, the consequences of refusing to sign the consent. Remember, even with this new form, patients still maintain the right to revoke consent at any time by submitting a written request. Protecting patient data is paramount, and the new regulations emphasize that with HIPAA breach notification requirements now applying to unsecured SUD records. This means if there's a breach of patient information, you'll need to notify them in accordance with HIPAA guidelines. Unsecured SUD records are those not rendered unreadable or inaccessible to unauthorized individuals. To comply with breach notification requirements, you'll need to ensure you have established breach response protocols in place. Train staff on identifying and responding to potential breaches. Keeping patients informed about how their information is used and protected is also crucial. Under the new regulations, your patient privacy notices need to be updated to reflect the changes. This includes highlighting the option for patients to provide single consent for TPO purposes, stating that information disclosed with patient consent for TPO may be further disclosed by certain entities under HIPAA regulations. If your program engages in fundraising, the notice must explain how patient information may be used for such purposes only after providing patients with a clear opportunity to opt out of receiving fundraising communications. Part 2 regulations emphasize patient empowerment. Similar to HIPAA, patients now have the right to request restrictions on how their SUD information is used and disclosed for TPO, even if they've already provided consent. However, it's important to understand that you are not obligated to agree to all restriction requests. You only need to comply if the request aims to limit disclosure to a health plan solely for payment or healthcare operation purposes, and the patient has already paid for the service in full. With these changes, it's natural to feel overwhelmed, but remember, you don't have to navigate this alone. The final rule becomes effective 60 days after publication in the Federal Register, which is April 16, 2024. However, you don't need to wait until then to start preparing. Here are some steps you can take to ensure compliance. Review your consent and authorization forms, policies, and procedures. Update your privacy notices to reflect the new regulations. Train your staff on the new requirements, and review your breach response protocols. If you need further assistance, the HHS website offers valuable information and guidance. And of course, you can reach out to me to help. I hope this video provided a clear overview of the key changes introduced by the new Part 2 regulations. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And if you want to know more information about medical coding, compliance, the revenue cycle, and healthcare in general, well then watch one of these videos. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.